According to Galen, personality limitations depended on body types such as Kretschmer, Lombroso, Sheldon. Body humor. All of the above. All the above. Note, early personality perception suggested limited number of personalities and depended on body type, Galen, Kretschmer, Lombroso, Sheldon, or body humor. 2. Stress and personality types. Types A according to Friedman and Rose-Ham in 1959 included characteristics such as relaxed, patient, easygoing, less vulnerable to heart disease. None of the above. None of the above. Note, the above is type B. Stress and personality types. Type A Friedman and Rosenhan 1959. Characterized according to behavior as competitive/striving/achievement-oriented, impatient /time urgency, hostile and aggressive, suffers from BP/raised stress hormones, unhealthy. 2. Trait theory is attributed to Raymond Cattell 1949-16 Personality factors. Guilford and McKinnon. Carl Rogers, Humanistic theory. Sigmund Freud, Psychodynamic approach. Carl Jung, Analytical psychology. Note, trait theory in psychology rests on the idea that people differ from one another based on the strength and intensity of basic trait dimensions. Hans Eysenck 1916-1997 proposed the theory of 3 factors. Now describe as 5 factors. All listed are 5 factors except openness to experience, conscientiousness, extroversion-introversion, agreeableness. All the above. Note, the theory of 3 factors are extroversion, neuroticism and psychoticism/intelligence. Skinner said there are 5 variables in his experience analysis of behavior. All listed are variables except 1. Expectation, subjective values, neuroticism, self-regulation. None of the above. Note, 5 variables include competence, encoding strategies and personal constructs, expectations, subjective values, self-regulatory systems and plans. Odd and eccentric types of personality disorder. Borderline, narcissistic, dependent, schizoid. None of the above. Note, cluster A, odd and eccentric, paranoid, schizotypal and schizoid. In CBT, coping strategies can include psychopharmacology, self-awareness, muscle tension, sweating, palpitation. Note, CBT coping strategies include diaphragmatic breathing, progressive muscle relaxation, self-monitoring, behavioral activation, decision-making. Pros and cons, cognitive restructuring and setting and managing goals. The following management technique can be used in PTSD except relaxation techniques, assertive training, TFCBT, exposure. None of the above. Note, trauma-focused CBT, TFCBT, exposure therapy, non-TFCBT approach which includes stress management, relaxation techniques, breathing technique, positive thinking/self-talk, assertive training and stress-modulating training, and eye movement desensitization reprocessing, EMD. EMDR, eye movement desensitization reprocessing, is not standard treatment in PTSD, is not focused, has limited elements, use of literal physical stimuli. None of the above. Note, it is considered standard TX in PTSD, is focused, and comprises several elements and the use of bilateral physical stimuli. The following are SSRIs antidepressants: quetiapine, prazosin, venlafaxine, amitriptyline. None of the above. Note, quetiapine, a typical antipsychotic, prazosin, a blocker, venlafaxine, SSNRI, amitriptyline, TCA. Dissociative disorder. There is no depersonalization. There is no derealization. There is no depression. Occurs in alcohol use always. None of the above. Note, dissociative disorders are characterized by disturbances in the integration of mental functions, characterized by depersonalization, derealization, and amnesia. Dissociative disorder. Family history may be significant. Hormonal dysfunction may be responsible. Prolonged exposure to stressor may be cause. EMDR is form of management. All the above. Note: benzodiazepines can present with except tinnitus, epilepsy, psychosis, retrograde amnesia, muscle twitching. Note: BDZ may cause anterograde amnesia. Buspirone, serotonin antagonist, partial serotonin antagonist, partial serotonin agonist, GABA agonist, GABA antagonist. Note: partial agonist at 5-HT1A receptor and is used primarily for generalized anxiety disorder. Tricyclic antidepressants. Phenelzyme MAOI, Moclobamide MAOI, citalopram SSRI, sertraline SSRI, dofepine. Note: TCA include amitriptyline, Elavil, clomipramine, anafranil, doxepin, sinequin, imipramine, tofranil, trimipramine, sermentil, amoxapine tablets, desipramine, norpramine, nortriptyline, Pamelor, Aventil, and protriptyline, Vivactil. The treatment for TCA overdose is for sodium bicarbonate. Buspirone adverse effects include the following except dizziness, B-blocking, antihistamine, HR awareness, dependence. Note: buspirone does not tend to cause sedation, nor does it produce a significant withdrawal syndrome or dependence. The following are seen in postpartum depression: reduced estrogen, reduced progesterone, high cortisol asterisk, high levels of prolactin. None of the above. Note: in PPD estrogen, prolactin and cortisol, high only transiently, levels are low while progesterone levels are high. The following are well matched: SSRIs, low birth weights; lithium, neonatal withdrawal syndrome; Haldol, cleft palate; lamotrigine, tricuspid valve defect. None of the above. Note: neonatal withdrawal or neonatal abstinence syndrome, NAS, or neonatal opioid withdrawal syndrome, NOWS, is a withdrawal syndrome of infants after birth caused by in utero exposure to drugs of dependence, most commonly opioids. Moderate learning disabilities. Acquire language with delay. Has everyday purpose speech. Achieve full independence. Can do simple structured tasks. Can do practical work than academic. Note: characteristics of moderate learning disabilities include slow in developing comprehension and use of language, self-care, and motor skills retarded. Some require supervision, progression in school limited, may have basic skills /reading /counting /comprehension /education does them well, can do simple structured tasks and are fully mobile. The rest of the above options are true for mild learning disabilities. Normal development of child. Walks at 36 to 12. First word 24 of 12. Toilet training 60/12. Holds head 9 out of 12. None of the above. Note: normal development of child, holds head 7/12, walks December 18, 12, first word 12/12, toilet training 3.5. One of the following can cause learning disabilities: Down syndrome, Fragile X syndrome, phenylketonuria, fetal alcohol syndrome. All the above. Note: all the following present in Asperger's syndrome except high-functioning autism, severe impairment in social behavior, repetitive behaviors, restricted interests, affects more females than males. Note: it is described as high-functioning autism characterized by severe persistent impairment in social interactions and repetitive behaviors / restricted interests. Asperger's syndrome is far more prevalent in males. About Rett syndrome. It's an autosomal dominant-caused disease. Affects males more. It is X-linked dominant disorder. Child shows disorder from birth. Child loses hand skills. Note: it is an X-linked dominant disorder that affects females exclusively. Initial development is normal. Between 6 months and 4 years the patient may begin exhibiting deceleration of head growth, loss of hand skills, language deteriorates and / or abnormal gait. In pervasive development disorders otherwise not specified atypical autism, there is good communication. Interests are intact. Meets criteria for Asperger's syndrome. Social interaction is spared. There is weak evidence of it being caused by products containing mercury. Note, the pervasive developmental disorders are characterized by severe impairments in social interactions and communication skills, restricted, stereotyped interests and behaviors. The abuser seeks power, seeks gratification, has internal inhibitors, absence of external inhibitors, child vulnerability. Note, the following are the abuser's motives: control/power, sexual gratification, motivation to sexual abuse, absence of internal inhibitors, absence of external inhibitor, child's vulnerability and maintaining factors which include cultures and accommodation types. In schizophrenia: delusions, bewildered, excitement, confusion, none of the above. Note, there are no pathognomonic signs or symptoms. However, its DX comprises the following signs/symptoms: hallucinations, delusions, disorganized speech, disorganized behavior, or negative symptoms, e.g., flat affect, anhedonia, apathy. CRO, type 1 dementia of dementia praecox has predominant negative symptoms, predominant positive symptoms, enlarged ventricles, poor response to antipsychotics, none of the above. Note, type 1 dementia of dementia praecox has predominant positive symptoms: acute, dopamine dysregulation, improved response of antipsychotics. Not a cholinesterase. Tacrin, donepezil, rivastigmine, galantamine, memantine. Note, memantine NMDA receptor antagonist, used in moderate to severe dementia. Pick's disease, Huntington's disease, Alzheimer's disease, stroke, Wilson's disease. None of the above. Note, frontotemporal dementia/Pick's disease/frontal lobe dementia is characterized by atrophy of the frontal and temporal lobes. In Wilson's, tau bodies, Pick's disease. Coded in chromosome 14, coded on chromosome 13. Atrophy brain, not a typical feature. Autosomal dominant, autosomal recessive. Cirrhosis. Note, features of Wilson's disease include personality change, cognitive change, extrapyramidal disorders, cirrhosis, psychosis, dementia, drooling, rigidity, bradykinesia, dystonia, and Kaiser-Fleischer rings. In depression, there is hopelessness, dejection, always suicidal thoughts, anhedonia, loss of interest. Note, anhedonia is a hallmark feature of depression. In bipolar II, depressive episode is essential in diagnosis. Mania is essential in diagnosis. Hypomania may present. Cyclothymia is not essential. None of the above. Note, DSMV criteria requires a history of one or more major depressive episodes and at least one hypomanic episode for the DX of bipolar II disorder to be made. Bipolar I. Manic episode is essential. Depressive episode is non-essential. Hypomania is essential. Cyclothymia is not essential. Dysthymia is essential. Note, bipolar I disorder involves episodes of mania and of major depression. However, episodes of major depression are not required for the diagnosis. 34. In postpartum depression, the following drugs are useful except nortriptyline, paroxetine, sertraline, diazepam. None of the above. Note, in the treatment of postpartum major depressive disorders, nortriptyline, paroxetine, Paxil, and sertraline, Zoloft, are in general considered to be the preferred medications. Stimulants include cocaine, methamphetamine, dextroamphetamine, heroin, ecstasy. Note, question was answered on a basis of exception. Cocaine, methamphetamine, dextroamphetamine and ecstasy are classified as psychostimulants, unlike heroin, which is a sedative amongst other effects, analgesia and dependence. 36. The following can be used for detoxification. Lofexidine, a 2 agonist used symptomatic MGT of acute opioid withdrawal. Methadone, buprenorphine, naltrexone. All the above. Note, buprenorphine plus naloxone 4:1 combination is used in opiate detoxification. Suboxone has buprenorphine, has naloxone. Mixture of the above in ratio 1:4 respectively. Useful in detoxification. None of the above. Note, Suboxone, buprenorphine and naloxone is used to treat opiate addiction, withdrawal, in a ratio is 4:1, respectively. In alcoholic Wernicke's encephalopathy, alcohol should be stopped. Parenteral thiamine is essential. Delirium tremens occur. Nystagmus is absent. Hypoglycemia can occur. Note, Wernicke's encephalopathy is characterized by confusion, ataxia and ocular palsy, ophthalmoplegia and nystagmus. Management comprises admission, withdrawal of alcohol and urgent parenteral thiamine. 39 Marquis-Fava-Bignami syndrome. Neurological disease of alcoholism. Corpus callosum demyelination. Corpus callosum necrosis. Imaging is non-essential. Thiamine deficiency may occur. Note, question was answered on a basis of exception. Marquis-Fava-Bignami syndrome is a progressive neurological disease of alcoholism characterized by corpus callosum demyelination and necrosis and subsequent atrophy. Management comprises H&E, lab, imaging, MRI/CT. White matter equals cortical atrophy, ventricular enlargement, and appropriate alcohol/comorbid management. In delirium tremens, chlordiazepoxide 100 g/day can be given. Patients are treated as outpatients. Haloperidol 10 g/day is essential. Vit B complex is essential. Electrolytes may not be as essential as sugar to be checked in the patient. Note, question was answered on a basis of exception. DT is a medical emergency and therefore, patients must not be treated as outpatients. Tricyclic antidepressants are contraindicated in glaucoma, brain tumor, bronchial asthma, essential hypertension. Note, cause mild pupillary dilation, which in susceptible individuals can lead to an episode of angle closure glaucoma. Which of the antipsychotic drugs has a prolonged action? Trifluperazine, thioridazine, penfluridol, flufenazine. Note, long-acting injectable antipsychotics for uncooperative patients include flufenazine decanoate, haloperidol decanoate, risperidone microspheres, paliperidone palmitate. The congenital anomaly produced by lithium therapy is limb shortening, anencephaly, heart block, renal agenesis. Note, the most common congenital malformations is Epstein's anomaly of the tricuspid valves. All the following are side effects of fluoxetine, except weight gain, sweating, urinary retention, diarrhea. Note, fluoxetine is a SSRIs. It inhibits presynaptic serotonin pumps that take up serotonin, leading to availability of serotonin in synaptic clefts. Common side effects: insomnia, anxiety, sexual dysfunction. Akathisia is treated by all the following, except trihexyphenidyl, diazepam, haloperidol, promethazine. Note, akathisia refers to subjective anxiety, restlessness and objective fidgetiness. Patients may report a sensation of inability to sit still. Best treated with B blockers or benzodiazepines. Literature on promethazine was not conclusive enough to support its use in TX of akathisia. Therefore, research further. Prophylactic maintenance of serum level of lithium is 0.2 to 0.8 milliequivalent/L, 0.7 to 1.2 milliequivalent/L, 1.2 to 2.0 milliequivalent/L, 2.0 to 2.5 milliequivalent/L. Note, therapeutic range 0.6 to 1.2, toxic, greater than 1.5 and potentially lethal, greater than 2.0. The treatment of choice in depression with suicidal tendencies is tricyclic antidepressants, MAO inhibitors, fluoxetine, electroconvulsive therapy. Note, the first and most important indication for ECT is depression with suicidal tendencies. The drug not used for prophylaxis of NDP is carbamazepine, sodium valproate, chlorpromazine, lithium. Note, antipsychotics are used as adjuvant in the treatment of mood disorders. All the following are true about clozapine, except used in schizophrenia, precipitate seizures, agranulocytosis, extrapyramidal side effects. Note, the only FDA-approved indication for clozapine is as a therapy for treatment-resistant schizophrenia. Animal models show that clozapine is more active over mesolimbic pathway than nigrostriatal pathway, resulting in it having less APS. Which of the following is not an antidepressant? Trazodone, amitriptyline, fluoxetine, pimozide. Note, pimozide is a typical antipsychotic. A patient of schizophrenia treated for 5 years developed abnormal movement. The patient has tardive dyskinesia, muscular dystonia, akathisia, malignant neuroleptic syndrome. Note, TD is a delayed effect of antipsychotics caused by dopamine receptor supersensitivity in basal ganglia. Serotonin, dopamine antagonists may be used in PTS with TD. The mechanism of action of fluoxetine is serotonin reuptake inhibitor, MAOB inhibitor, noradrenaline reuptake inhibitor, benzodiazepine antagonist, other SSRIR. Note, it is a SSRIs with longest half-life. An irritable urge to move about with inner restlessness is called akathisia, akinesia, hyperkinesia, dyskiness. Note, dyskinesia is defined as uncontrolled, involuntary muscle movement, hyperkinesia is abnormally increased and sometimes uncontrollable activity or muscular movements, and akinesia is a term for the loss of ability to move your muscles voluntarily. The drug of choice for rapid cycle MDP is lithium, carbamazepine, sodium valproate, haloperidol. Note, rapid cycling is defined by the occurrence of 4 or more mood episodes in 1 year, major depressive, hypomanic, or manic. A 35-year-old female on chlorpromazine for 10 years schizophrenia complains of hearing voices. The loudness of the voices of taking chlorpromazine but not stop completely. The best treatment is clozapine, haloperidol, tianeptine, sulpiride. Note, clozapine, the only FDA-approved drug for treatment-resistant schizophrenia. She has been on chlorpromazine for 10 years. Tianeptine is a selective serotonin reuptake enhancer, selective serotonin reuptake inhibitor, selective norepinephrine reuptake inhibitor, norepinephrine agonist. Note, tianeptine, norepinephrine serotonin selective reuptake enhancers, in contrast to SSRIs, actually increases 5-HT reuptake. A 50-year-old man has presented with pain in back, lack of interest in recreational activities, low mood, lethargy, decreased sleep, and appetite for 2 months. There is no history suggestive of delusions or hallucinations. He did not suffer from any chronic medical illness. There was no family history of psychiatric illness. Routine investigations including hierogram, renal function tests, electrocardiogram, did not reveal any abnormality. This patient should be treated with haloperidol, sertraline, alprazolam, olanzapine. Note, the only antidepressant in this group, clinical history suggests that the patient is depressed. Carbamazepine was first used in depression, MDP, anxiety, all of the above. Note, carbamazepine is an anticonvulsant and mood-stabilizing agent. It is a tricyclic compound synthesized in 1953 by Schindler. The treatment of choice for acute or abrupt onset depression includes lithium, tricyclic antidepressants, MAO inhibitors, electroconvulsive therapy. Note, ECT is indicated for rapid reduction of symptoms, e.g., immediate suicide risk, refusal to eat/drink, catatonia, in addition to patients unresponsive to pharmacotherapy and patients who cannot tolerate pharmacotherapy, pregnancy, etc. In acute mania, the therapeutic serum level of lithium includes 0.2 to 0.5 mg/L, 0.8 to 1.5 milliequivalents/L, 1 to 2 milliequivalents/L, 2 to 5 milliequivalents/L. Note, therapeutic range, 0.6 to 1.2, toxic, greater than 1.5 and potentially lethal, greater than 2.0. Antipsychotic drug to be avoided especially in first trimester of pregnancy. Chlorpromazine, haloperidol, carbamazepine, lithium. Note, it is associated with congenital malformations which include increased incidence of spinal bifida. Lithium is used in psychiatry to treat hysteria, phobia, mood disorders. Acute organic brain syndrome indications of lithium in psychiatry. Note, TX of acute mania, prophylaxis of bipolar mood disorders, schizoaffective disorder and impulsive aggression. Clozapine is a atypical antipsychotic, anti-anxiety drug, used in dementia, also known as disulfiram. Note, clozapine, atypical antipsychotic, is the drug of choice in treatment-resistant schizophrenia. Paroxetine is a antipsychotic drug, used in opiate poisoning. Tricyclic antidepressant, selective serotonin reuptake inhibitor. Note, others SSRIs includes paroxetine, fluvoxamine, fluoxetine, sertraline, citalopram. Also remember, SSRI with longest half-life fluoxetine, SSRI with shortest half-life fluvoxamine. Imipramine is mainly used as a sedative, tranquilizer, antidepressant. All of the above. Note, imipramine was the first tricyclic antidepressant to be introduced. Nausea is a troublesome side effect of the following antidepressant: doxepine, fluoxetine, trazodone, mianserin. Note, other side effects: insomnia, akathisia, loss of appetite, sexual dysfunction. Which antidepressant was found to be associated with tardive dyskinesia and narcoleptic malignant syndrome? Amoxapine, trazodone, fluoxetine, ammoneptine. Note, this is because of blockade of dopamine receptors in the striatum. Blood levels of neuroleptics are useful to check the following: toxic ability, therapeutic levels, resistance. All of the above. Note, clozapine and haloperidol levels are important to monitor toxicities. The drug of first choice in weight reduction program is amphetamine, phenylethylamine, fenfluramine, diethylpropion. Note, diethylpropion is used as part of a short-term plan, along with a low-calorie diet, for weight reduction. It is used in obese patients who have not been able to lose weight with diet and exercise alone. It belongs to the group of medicines known as appetite suppressants. Therapeutic range of lithium is (0.8 to 1.4 mol/1), 1.4 to 2.5 mol/1, 1.0 to 2.6 mol/1. Note, remember toxicity: if level greater than 2.0 milliequivalent/1, life-threatening intoxication, greater than 3.5 milliequivalent/1. Akathisia, neurotic disease, seen in schizophrenia. Side effect of lithium, side effect of antipsychotic drugs. Note, akathisia manifests as motor restlessness. It is due to blockade of dopamine type 2 receptors in striatum. Neuroleptic malignant syndrome is characterized: bradycardia, labile hypertension, hypotonia, hypothermia. Note, MNS is characterized by fever, most common presenting symptom, autonomic instability, tachycardia, labile hypertension, diaphoresis, leukocytosis, tremor, elevated CPK, rigidity. Lead pipe rigidity is considered almost universal, excessive sweating, diaphoresis, and delirium, mental status changes. Akathisia is treated by haloperidol, fluoxetine, propranolol, lithium. Note, akathisia, subjective anxiety, restlessness, and objective fidgetiness. Patients may report a sensation of inability to sit still. Best treated with B blockers or benzodiazepines. Feature of akathisia is cogwheel rigidity, oculogeric crisis, restlessness, periodic movements. Note, motor restlessness is the key feature of akathisia. Cogwheel rigidity occurs in Parkinsonism, oculogeric crises is in acute dystonia, periodic movement could be rabbit syndrome or tardive dyskinesia. Malignant neuroleptic syndrome is treated by dantrolene, diazepam, haloperidol. Chlorpromazine bromocriptine can also be used. Note, skeletal muscle relaxants such as dantrolene are used to TXMNS. Side effect of clozapine is within 1 week, neutropenia, DLVE, D2 plus VE, agranulocytosis, excitement. Note, 1% incidence of agranulocytosis. Convulsions are dose-dependent adverse effects seen only in high doses, whereas agranulocytosis is independent of dose. Clozapine must be stopped. The drug of choice for obsessive-compulsive disorder is haloperidol, clomipramine, amitriptyline, diazepam. Note, it is the most serotonin-selective TCA. Dose of clomipramine, 75 to 300 mg 1 day. Lithium is used in all except endogenous depression, recurrent attacks of mania, schizoaffective psychosis, paranoid psychosis. Note, lithium is the drug of choice in acute mania and is prophylaxis for both manic and depressive episodes in bipolar and schizoaffective disorders. It is also used in cyclothymic disorder and unipolar depression. Side effect of chlorpromazine for which anticholinergic is used: blurred vision, oculogeric crises, hypotension, dry mouth. Note, oculogeric crises are defined as spasmodic movements of the eyeballs into a fixed position, usually upwards. The drug of choice for panic disorders is imipramine, nitrazepam, clonidine, diazepam. Note, small doses of antidepressants are used, imipramine and fluoxetine. A 50-year-old woman who has been treated with amitriptyline for major depressive disorder for more than 2 years comes to you at Mutanwa Campus Clinic because she has had weakness, cold intolerance, constipation, and weight gain during the past 6 months. Physical examination was done by Dr. Soda and shows dry, coarse skin as well as bradycardia, hypothermia, and swelling of the hands and feet. Which of the following laboratory tests is the most appropriate to determine the diagnosis? Liver function testing, measurement of serum electrolyte levels, measurement of serum estrogen level, measurement of serum sertraline level, measurement of serum thyroid stimulating hormone level. Note, suspect hypothyroidism. A 35-year-old man with bipolar disorder, most recent episode mixed, comes to the clinic for routine follow-up examination. His condition has been difficult to control and has required treatment with multiple medications during the past 2 years. The patient says his mood has been stable with his current regimen, but for the past 3 months, he has had tremor primarily affecting his hands. Which of the following medications is the most likely cause of this patient's tremor? Carbamazepine, gabapentin, lamotrigine, lithium carbonate, topiramate. Note, tremor is a common adverse effect of lithium carbonate. A 19-year-old lady who is a Lama University student studying medicine is brought to the clinic by her roommate in Roma residential area because she has been acting strangely during the past 6 months. During the past month, the patient has been describing how another person's thoughts have been entering into her mind. The patient's grades have been slipping, and she does not talk as much as she did previously. The roommate says that when the patient does talk, she strays from the topic and is hard to follow. During the interview, the patient says a television reporter at ZNBC told her that the government had a special message for her and she should listen to the radio all the time for further instructions. Which of the following conditions is the most likely cause of this patient's symptoms? Acute stress disorder, delusional disorder, schizoaffective disorder, schizophrenia, schizophreniform disorder. Note, the patient has had classic symptoms of schizophrenia for at least 6 months, including hallucinations, voices speaking to her, social dysfunction affecting grades and friendships, and disorganized speech. A 37-year-old man from Chelstone residential area comes to the office after he experienced what he says was a nervous breakdown. The patient says that after he recently declared bankruptcy, losing his home and his business, he became very depressed. During this time, he began to hear voices telling him that he was useless and should kill himself. The patient says his symptoms stopped after approximately 1 week. He has had no similar episodes. Medical history includes no psychiatric conditions. Physical examination shows no abnormalities, and results of laboratory studies are within normal limits. Which of the following is the most likely diagnosis? Borderline personality disorder. Brief psychotic disorder. Major depressive disorder with psychotic features. Schizophrenia. Schizophreniform disorder. Note, essential features of brief psychotic disorder include sudden onset of one or more of the following symptoms: delusions, hallucinations, disorganized speech, disorganized behavior, and catatonia. Brief psychotic disorder is also characterized by duration of symptoms for at least 1 day but less than 1 month, followed by return to pre-morbid level of functioning. A 28-year-old man from Kamanga compound comes to the office because he has had severe restlessness, anxiety, and generalized myalgia during the past 3 days. The patient says he has not slept for the past 2 days. Physical examination shows dilation of the pupils, excessive lacrimation, diaphoresis, and piloerection. The most likely cause of this patient's condition is withdrawal of which of the following substances? Cocaine, inhalants, methamphetamines, modafinil, opioids. Note, insomnia, dilation of the pupils, piloerection, diaphoresis, lacrimation or rhinorrhea, and myalgia are classic symptoms of opioid withdrawal. A 48-year-old man, a farmer from Monstown in Southern Province, comes to the office for annual physical examination. The patient has smoked 1 pack of cigarettes daily for the past 20 years and says he wants to quit. He has tried to quit several times, but every time he does, he has depressed mood, difficulty sleeping, anxiety, restlessness, and increased appetite. The patient says these symptoms are so severe that he is unable to function well at work. Which of the following is the most appropriate therapy to aid in smoking cessation for this patient? Alprazolam, diazepam, nicotine transdermal patches, nicotinic acid, varenicline. Note, nicotine transdermal patches are used as an aid in smoking cessation and are not likely to exacerbate a patient's symptoms of depression, anxiety, or sleep disturbance. A 55-year-old woman from Kasempa, Northwestern Province, comes to the office because she has a 20-year history of repetitive actions and is tired of wasting time by repeating these actions. The patient says she repeatedly checks the doors in her house to make sure they are locked, washes her hands several times per hour, and checks her electrical appliances 3 times each morning before she leaves for work. Medical history includes second-degree atrioventricular block. Which of the following medications is the most appropriate initial therapy for this patient's psychiatric disorder? Clomipramine, clonazepam, methylphenidate, quetiapine, sertraline. Note, DDX obsessive-compulsive disorder. Sertraline is a selective serotonin reuptake inhibitor, SSRI. A 20-year-old woman from Kasama who is a college student comes to the health center because she has had symptoms of depression for the past 3 months, since she was a victim of rape at a party. The patient says she was heavily intoxicated when the incident occurred and has little memory of the event, but she was embarrassed and ashamed when she awoke at the scene and realized what had happened. She did not seek medical care at that time. The patient says she has not told her friends about the incident, and she has continued to attend classes and work part-time. However, she says she constantly feels sad and anxious, has become tearful and withdrawn, and has had difficulty sleeping because of frightening nightmares. This patient most likely has which of the following psychiatric conditions? Acute stress disorder, adjustment disorder, unspecified, generalized anxiety disorder, major depressive disorder, post-traumatic stress disorder. Note, the patient described meets the criteria for post-traumatic stress disorder, which include the following: involvement in a traumatic event, duration of symptoms for more than 1 month, and significant effect on daily life due to depression, anxiety, nightmares, and social withdrawal. A 42-year-old man from ZAF Mumbai is referred to the office for mental health evaluation. The patient says he has a long-standing fear of criticism and rejection. He also has feelings of inadequacy and refuses to try new activities because of his fear of embarrassment. The patient has held the same entry-level position at his workplace for the past 14 years despite several opportunities for promotion. The patient is unmarried and has only had 1 intimate relationship, which lasted only a few weeks. He has few friends other than those in his model airplane club. Which of the following personality disorders is the most likely diagnosis? Avoidant, dependent, paranoid, schizoid, schizotypal. Note, avoidant personality disorder is characterized by fears of rejection, disapproval, and/or criticism, unwillingness to be involved with people unless assured of being liked. A 23-year-old man from Kafui National Park comes to the office because he has pain in his right hand. He does not recall what the cause is. He recalls one day having a dispute with John Nyadenda. The nurse says the patient was irritable and reluctant to answer many intake questions, and he refused to put on an examination gown. On questioning, the patient is initially charming and glib, but after he is assured that the information he shares will not be relayed to his probation officer, he admits that he was involved in a fistfight. He says proudly that the other guy is in a lot worse shape. This patient most likely has which of the following psychiatric conditions? Antisocial personality disorder, bipolar disorder, most recent episode hypomanic, conduct disorder, Oppositional defiant disorder. Paranoid personality disorder. Note, although the patient seems charming and slimy, he is aggressive and clearly exhibits disregard for social norms and rights of others. These findings are characteristic of antisocial personality disorder. A 46-year-old man from Calabo Western Province is brought to the emergency department at Lawanica General Hospital by ambulance because he has been having visual hallucinations for the past 4 hours. The patient's wife says he has had diarrhea, agitation, and confusion for the past 2 days. 2 weeks ago, while in Calabo working as a police officer, he was fired from his job because of excessive absences. He has been unable to find a new job and has been asking his friends for money for several days. The patient has a 25-year history of drinking 1 pint of Bomba and Bode daily. Temperature on examination is 38.5 degrees Celsius 101.3 degrees Fahrenheit, pulse rate is 126/min, and blood pressure is 162/102 mmHg. Which of the following is the most appropriate initial management of this patient's condition? Admission to the hospital for monitoring and social services evaluation. Discharge and referral to an outpatient alcohol treatment center. Intramuscular injection of haloperidol and discharge. Intravenous infusion of ethyl alcohol and discharge. Oral administration of chlordiazepoxide and admission to the hospital. Note, the history and physical examination findings in this patient represent delirium tremens due to chronic alcohol use. Therefore, oral administration of chlordiazepoxide and admission to the hospital is the most appropriate initial management because of the potential for seizure activity. A 35-year-old woman is brought to the emergency department from Tendera compound by ambulance after Tendera police were called to her home Tendera by a neighbor, Mrs. Banda, who witnessed rape and robbery by 2 young men intruders. The patient is fully alert and oriented to person, place, and time. She cannot remember anything about the incident. Which of the following is the most likely cause of this finding? Depersonalization/derealization disorder, depersonalization disorder. Dissociative amnesia. Fugue state. Traumatic brain injury. Volitional memory loss. Note, dissociative amnesia is characterized by inability to recall important information, usually of a traumatic or stressful nature, that is too extensive to be considered ordinary forgetfulness. A 26-year-old man from Libala Township in Lusaka is brought to you with a history of involuntary eye blinking and snorting. He is distressed about increasing frequency of these tics over the past 6 months. The patient says the episodes currently occur numerous times during the day. Medical history includes development of eye blinking at 12 years of age and development of snorting, making a sudden sound through one's nose, at 16 years of age. Psychotherapy and exercises initially reduced the frequency of these episodes. Because the patient is embarrassed by his tics, his performance at work has decreased and he now declines most invitations to social gatherings. Which of the following medications is the most appropriate therapy for this patient? Carbamazepine, fluvoxamine, methylphenidate, risperidone, venlafaxine. Note, DDX Tourette disorder, in severe cases atypical antipsychotics are used. A tic is a rapid, recurrent, non-rhythmic, stereotyped movement of vocaliza. A 19-year-old Chinama college student comes to the Levi Mwanawasa outpatient department for assessment because she has been purging food during the past semester. The patient appears well-developed and well-nourished. Physical examination shows mild enlargement of the parotid glands. In addition to complete blood cell count and urinalysis, measurement of which of the following levels is most appropriate? Fasting blood glucose, serum amylase, serum electrolytes, serum liver enzymes, serum thyroid stimulating hormone.
Note, patients who purge are at increased risk for hypokalemia and broncha or hypochloremia alkalosis because of vomiting.
A 5-year-old boy is brought to the clinic by his mother because she is worried about changes in his behavior during the past few months. The patient's mother says he has had episodes that occur sporadically at night during which he sits up in bed screaming, crying incoherently, and intensely frightened. She says it is initially difficult to calm him down, and he is usually sweating, breathing rapidly, and tremulous. The patient eventually calms down after 10 to 15 minutes and then falls asleep. Which of the following questions is most appropriate to confirm the suspected diagnosis of sleep terror disorder in this patient? Do his arms and legs jerk during sleep? Does he have nightmares? Does he go to sleep late? Does he watch violent movies? Does he wet the bed? Which of the following is not seen in mania? Delusion of grandeur, elation, pressure of speech, disorientation. Note, criteria for mania, *3, GST-paid, grandiosity, sleep, decreased need, talkative, pleasurable activities, painful consequences, activity, ideas, flight of, distractible. The commonest psychiatric disorder is dementia, B. Schizophrenia, paranoia, depression. Note, however, depression ranks second to anxiety disorder as previously noted. Endogenous depression is characterized by all of the following, except paranoid feeling, third-person hallucination, guilt psychosis, loss of self-esteem. Note, both endogenous and exogenous depression now fall under the bracket of MDD as the treatment is the same. Endogenous depression has also been referred to as melancholic type of MDD. This is a severe form of MDD where mood-congruent delusions and hallucinations may be present, accounting for paranoid feeling and third-person hallucinations in addition to loss of self-esteem and other typical feature. However, no literature has been found to support or dispute guilt psychosis. The neurotransmitters involved in depression are GABA and dopamine, serotonin and norepinephrine, dopamine and serotonin, GABA and norepinephrine. Note, of the biogenic amines, norepinephrine and serotonin are the two neurotransmitters most implicated in the pathophysiology of mood disorders. The drug of choice for depression in an old person is fluoxetine, buspirone, amitriptyline, imipramine. Note, older literature clearly indicates fluoxetine as the drug of choice for depression in geriatric patients. However, recent literature only suggests a number of drugs including buspirone with none being unanimously indicated as the drug of choice. Delusions of nihilism and early morning insomnia are seen in major depression, schizophrenia, mania, personality disorder. Note, it is not uncommon for major depression to present with psychotic features such as delusions along with a typical feature which include early morning insomnia, terminal insomnia. The most common age group for depression is middle-aged men, middle-aged females, young girls, children. Note, depression is common among women between the ages of 15 to 35 years. A period of normalcy is seen between two psychotic episodes in schizophrenia, manic depressive psychosis, alcoholism, depression. Note, Emil Kraepelin first coined the term manic depressive psychosis, after noting that periods of acute illness, manic or depressive, were generally punctuated by relatively symptom-free intervals where the patient was able to function normally. A 20-year-old male has presented with increased alcohol consumption and sexual indulgence, irritability, lack of sleep, and not feeling fatigued even in prolonged periods of activity. All these changes are present for past 3 weeks. The most likely diagnosis is alcohol dependence, schizophrenia, mania, impulse control disorder. Note, increased libido, irritable mood, and decreased need for sleep, excessive psychomotor activity characterizes mania in this case. Ms. Bwalia is a 27-year-old nurse working at Conda Square Clinic in Lusaka. She had an extracurricular interest in trekking and painting. She broke up relationship with her boyfriend. 2 months later she lost interest in her hobbies and was convinced that she would not be able to work. She thought life was not worth living and has consumed 60 tablets of phenobarbital to end her life. She is most likely suffering from adjustment disorder, conversion disorder, depressive disorder, post-traumatic stress disorder. Note, middle-aged female, loss of interest, feeling of worthlessness, suicidal ideation and attempt, and poor functioning are features suggestive of a depressive disorder. Major depression is most commonly associated with poverty, major accident, prolonged physical illness, death of loved person. Note, some clinicians believe that life events play the primary or principal role in depression, others suggest that life events have only a limited role in the onset and timing of depression. The most compelling data indicate that the life event most often associated with development of depression is losing a parent before age 11 years. Synopsis. A person initially presenting with an episode of mania is classified as unipolar, bipolar, affective disorder, personality disorder. Note, bipolar I disorder, single manic episode and a specific type of recurrent episode. Bipolar II disorder, it is characterized by depressive episodes and hypomanic episodes during the course of the disorder. Unipolar disorder, depressive episode only. Mania is a obsessive disorder, mood disorder, neurotic disorder, psychological disorder. Note, according to ICD-10, mood disorders are classified as 1. Manic episode, 2. Depressive episode, 3. Bipolar mood, affective disorder, 4. Recurrent depressive disorders, 5. Persistent mood disorder, including cyclothymia and dysthymia, 6. Other mood disorders, including mixed affective episode and recurrent brief depressive disorder. Mania is associated with the following, except euphoria, good humor, physical overactivity, thought disorders, Note, the humor of manic is described as inappropriate humor rather than good humor. Which of the following is not seen in mania? Delusions of grandeur. Elation. Pressure of speech. Disorientation. Note, disorientation occurs in delirium. Atypical depression is characterized by all of the following, except increased libido, weight gain, ravenous appetite, hypersonic weight gain, appetite. Note, atypical depression is characterized by hypersomnia, hyperphagia, may result in weight gain, reactive mood, leaden paralysis, heavy sensation usually in the limbs, and hypersensitivity to interpersonal rejection. Dysthymia is chronic mild depression, personality disorder, bipolar depression, chronic severe depression. Note, dysthymia is a mild, chronic form of depression that lasts at least 2 years, during which, on most days, the individual experiences depressed mood for most of the day and at least 2 other symptoms of depression. Depression is an affective disorder, organic disorder, mood disorder, dissociate disorder. Note, mood and affect are terms that are often used interchangeably. However, referring to a mood disorder as an affective disorder is considered a misnomer. Profound mood disturbance is seen with schizophrenia, psychosomatic illness, depression and mania. Affective disorders. Note, depression and mania are mood disorders where a pervasive and profound mood disturbance is mandatory to make a diagnosis. Somatic symptoms of depression include all, except feelings of guilt, reduced interest, insomnia, weight change. Note, somatic symptoms of depression refer to physical symptoms which include body aches/pains, loss of appetite, lack of energy, loss of pleasure in activities, sleep difficulties, and weight loss/gain. Which one of the following disturbances is the basic defect seen in mania? Elation. Ideas of reference. Coining of new jokes. Delusions of grandiosity. Note, mania is characterized by persistent elevated/elated, expansive mood by definition. Depression is not caused by metronome, methyldopa, reserpine, oral contraceptives. Note, drugs which can cause depression include reserpine, clonidine, methyldopa, OZ pills, propranolol, and anti-cancer drugs. However, metronome is not a drug but a musical device. The following are feelings of cyclothymic personality except mood swings, excessive planning, spending sprees, mood incongruent delusions. Note, cyclothymic disorder is a less severe disorder, with alternating periods of hypomania and moderate depression. The condition is chronic and non-psychotic. Patient may have recurrent mood swings which may lead to social and professional difficulties. Manic depressive psychosis is associated with Jules Falter, Sigmund Freud, Emil Kraepelin, K.L. Kalbaum. Note, Emil Kraepelin, using Kalbaum's concept of cyclothymia, first coined the term manic depressive psychosis, after noting that periods of acute illness, manic or depressive, were generally punctuated by relatively symptom-free intervals where the patient was able to function normally. Which drug is not useful in acute mania? Diazepam, clonazepam, ECT, chlordane. Note, drugs used in acute manic episode, mood stabilizers, antipsychotic and clonazepam. However, chlordane is not a pharmaceutical drug but a pesticide. Acute mania with mood disturbance is a feature of the following: borderline disorder, cyclothymiacs disorder, paranoid disorder. Note, cyclothymic disorder is a less severe disorder, with alternating periods of hypomania and moderate depression. Mood disorder is seen in hysterical state, borderline personality state, paranoid state, schizoid state. Note, affective instability is commonly seen in borderline personality disorders. Drug that is known to produce manic-like syndrome include all except amphetamine, corticosteroids, tricyclic antidepressant, reserpine. Note, reserpine induces depression. Features of depression include all except depressed mood, loss of appetite, hyperactivity, suicidal ideas. Note, depressed mood is the first among them. Loss of appetite and suicidal ideas are associated symptoms. Hyperactivity is unusual. It may occur in elderly. Which of the following is least likely to cause serious depression as a side effect of long-term use? Reserpine, propranolol, INH. None of the above. Note, the likelihood of depression 2 degrees reserpine and propranolol is dose-dependent, whereas that of INH is reported to be extremely rare. Which of the following drugs is used for maintenance of manic, depressive psychosis, MDP? Chlorpromazine, carbamazepine, haloperidol, amphetamine. Note, carbamazepine is a mood stabilizer used for maintenance therapy of MDP. All the following drugs are used in prophylaxis of MDP, except sodium valproate, carbamazepine, lithium, haloperidol. Note, drugs used in MDP prophylaxis are lithium, carbamazepine, sodium valproate, oxcarbamazepine, and lamotrigine. The family members of a 56-year-old man report that he has become increasingly irritable, sleepless, has started spending large amounts of money, and shows increased sexual behavior. The most probable cause could be mania, psychosexual developmental disorder, impulse control disorder, obsessive-compulsive neurosis. Note, irritable mood, reduced sleep, overspending, and distributed are features of mania. A 36-year-old female presents with no interest in anything, a nihilistic attitude, and a sad appearance with suicidal ideas and plans. The most appropriate management is antidepressants, behavioral therapy, ECT, aminophylline. Note, the patient is having severe depression and suicidal risk. In this case, the first choice of management is ECT. A 55-year-old lady presented with decreased sleep and appetite and thoughts of spiritualism. She donates money and property and talks about God. Her husband died a few days back and she has increased psychomotor activity. She is most likely suffering from PTSD, mania episodes, brief reaction, depression. Note, features pointing to a DX of manic episodes include decreased sleep, appetite, increased psychomotor activity, and donates money, with the passing of the husband likely being a precipitating factor. Thoughts of spiritualism and talking to God suggesting that it's likely manic episodes with psychotic symptoms. Delirium is not common in day-to-day clinical practice. Cannot occur following hip fracture surgery, transplant surgery, and burns. Not prevalent in hospitalized medically ill patients. The prevalence of delirium rises with age. Less seen in the terminally ill and in certain groups of postoperative patients. Note, delirium is extremely common in day-to-day clinical practice. This includes medical admissions units, surgical wards, oncology wards, and intensive care units. Its prevalence rises with age and is greater in the terminally ill, postoperative patients, e.g. following hip fracture surgery, transplant surgery, and burns. Delirium is a syndrome that is not characterized by concurrent disturbances of consciousness and attention, perception, cognition, behavior, emotion, and the sleep-wake cycle. Etiologically is specific. There are specific and multiple underlying etiological factors. It cannot be described using other terms. Acute confusional state. Note, delirium is also called acute confusional state, acute brain syndrome, or acute organic reaction. It is etiologically nonspecific. In epilepsy. Continuous condition associated with cerebral seizure activity. A seizure is a continuous cerebral dysfunction resulting from an excessive abnormal electrical discharge of neurons. It is a paroxysmal abnormal neuronal discharge. Focal seizures are not associated with detectable and potentially remediable cerebral lesions. Tonic-clonic seizures, most characteristic with loss of consciousness, occurs suddenly with no warning signs always. Note, in the definition of epilepsy, emphasis is made on the periodicity of the seizure activity. It is not continuous but rather transient or paroxysmal. In delirium tremens, the following is true except chlordiazepoxide 100 mg/150/day intravenously is useful. Parenteral vitamins, vitamin B complex is useful. It is important to titrate benzodiazepines to not more than 14 days. On recovery, consider counseling. Long-term management is essential. Note, chlordiazepoxide or any other BDZ are not given intravenously but orally. Substitution prescription, the following is true. Opioid use is increased. Can withdrawal drug. Withdrawal has serious consequences that can be treated under normal practice. Patient made to take a progressive quantity of addiction drug. Methadone is a drug of choice in opioid substitution. Note, opioid substitution therapy, OST, is a type of harm reduction initiative that offers people who are dependent on opioids, such as heroin, an alternative, prescribed medicine, most typically methadone or buprenorphine, which is swallowed rather than injected. Antidepressant medication is an initial primary treatment modality for moderate to severe major depressive disorder unless ECT is planned. Patient is less than 18 years of age. Patient is admitted to hospital. Patient is age 65 and older. Note, for psychotic depression, a combination of antipsychotic and antidepressant medication or ECT may be prescribed. Dysthymia may be treated with all of the following except antidepressants, cognitive behavioral therapy, ECT, interpersonal therapy. Note, TX for dysthymia include tricyclic antidepressants, selective serotonin reuptake inhibitors, SSRIs, and monoamine oxidase inhibitors, MAOIs. Therapies include cognitive and behavioral therapy. Symptoms of depression in children and adolescents include all of the following except persistent depressive or sad mood, irritability, gregariousness, anhedonia. Note, signs and symptoms lasting for at least 2 weeks, depressed mood most of the time, anhedonia, changes in appetite or weight, increase or decrease, feelings of worthlessness or excessive guilt, insomnia or hypersomnia, diminished concentration, psychomotor agitation or retardation, restlessness or slowness, fatigue or loss of energy, recurrent thoughts of death or suicide. Gregariousness refers to sociality. Prior to initiating bright light therapy for seasonal affective disorder, it is important to try a course of antidepressant drugs. Consider ophthalmological evaluation for persons with a history of eye disorders. Initiate milieu therapy. Complete a course of cognitive behavioral therapy. Note, because bright light therapy has the potential to cause eye strain and headaches, an ophthalmologic exam is advised for persons with a history of eye diseases. All of the following are associated with bipolar disorder except functional impairment, manic episodes, rapid cycling, frequent spontaneous resolution of all symptoms. Note, bipolar disorder is associated with functional impairments even during euthymic periods. Which of the following statement about children and adolescents with bipolar disorder is not true? Most require ongoing treatment to prevent relapse and some require lifelong treatment. Many have co-occurring disorders such as substance abuse, suicidality, and psychosocial issues. Treatment generally involves a combination of medication and behavioral/psychosocial interventions. A significant proportion outgrows the disorder and requires no further follow-up. Note, primary treatment for mania is pharmacotherapy, however, psychotherapy is an important component of comprehensive treatment. The goals of acute treatment for schizophrenia include all except encouraging introspection and reflection, eliminating or reducing symptoms such as disturbed behavior, reducing the severity of psychosis and associated symptoms, preventing harm. Note, the goals of treatment are to prevent harm, control disturbed behavior, reduce symptoms such as agitation and aggression, evaluate and address the stressors that triggered the acute episode, and enable rapid return to the best level of functioning. Encouraging introspection and reflection fall under long-term management. When may ECT be used to treat adults with schizophrenia or schizoaffective disorder? In both the acute phase and stable phase for psychotic symptoms that have not responded to pharmacological treatment. Only during the acute phase. Only during the stable phase. Only in persons who have not been treated with antipsychotic agents. Note, indicated if patient is unresponsive to pharmacotherapy, if patient cannot tolerate pharmacotherapy, pregnancy, etc., or if rapid reduction of symptoms is desired, e.g., immediate suicide risk, refusal to eat/drink, catatonia. The most common behavioral health problem in adults, adolescents, and children is depression, anxiety, ADHD, thought disorders. Note, anxiety disorders include panic disorders with or without agoraphobia, specific phobias, social anxiety disorder, obsessive-compulsive disorder, generalized anxiety disorder, and post-traumatic stress disorder, PTSD. Depressive disorders are the second most common across all age groups. An effective intervention for many anxiety disorders is antipsychotic agents alone, antidepressants alone, behavioral health treatment, especially cognitive behavioral therapy, ECT and pharmacotherapy. Note, MGX for most anxiety involves combination of psychotherapy and medication. Of psychotherapeutic interventions, cognitive behavioral therapy, CBT, has demonstrated efficacy, however, it requires the patient to commit to approximately 12 to 20 sessions of treatment. The percentage of persons with generalized anxiety disorder with a comorbid condition is 25%, greater than 50%, less than 20%, 15%. Note, more than half of persons diagnosed with generalized anxiety disorder have a comorbid condition such as panic disorder or major depressive disorder, most common. Symptoms of panic disorder may include all of the following except chest pain and tachycardia, feelings of impending doom, dizziness and shortness of breath, fever and shaking chills. Note, symptoms includes dizziness, disconnectedness, derealization, unreality, depersonalization, detached from self, palpitations, paresthesia, abdominal distress, numbness and nausea, intense fear of dying, losing control or going crazy, intense apprehension, chills, chest pain, sweating, shaking, shortness of breath. All of the following are true about panic disorder except panic attacks do not occur during sleep. It affects an estimated 6 million adults in the United States. Twice as many women are affected. The tendency to develop panic attacks appears to be heritable. Note, panic attacks occur suddenly, often without warning, and can occur at any time, even during sleep. Trichotillomania is an impulse-controlled disorder that involves disordered eating, an irresistible urge to pull out hair, compulsive gambling, harming pets and small animal. Note, also known as trich, it involves recurrent, irresistible urges to pull out body hair. All of the following statements about oppositional defiant disorder are true except it involves recurrent patterns of hostility and negative behaviors. It arises from a combination of genetic, biological, and environmental causes. It is a developmentally appropriate behavior displayed by children. Early onset is associated with poorer prognosis. Note, a disorder in a child marked by defiant and disobedient behavior to authority figures. It is characterized by angry, argumentative, vindictive, or defiant behavior for 6 months with marked distress or impairment. Persons with intermittent explosive disorder generally display all of the following except aggressive outbursts and violence, destruction of property, remorse, regret, and embarrassment about their actions, bulimia. Note, intermittent explosive disorder is characterized by repeated outbursts of aggressive, violent behavior. People with intermittent explosive disorder may attack and harm others, and vandalize and destroy property. Following these outbursts, they are often contrite, expressing remorse, regret, and embarrassment about their actions. Recurrent verbal or physical outbursts out of character for the person and disproportionate to the stress. All of the following are impulse disorders or disruptive behaviors except pathological gambling, kleptomania, mania, pyromania. Note, mania only has impulse control as part of its presentation but is not entirely an impulse disorder as pathological gambling, kleptomania, impulse to steal, and pyromania, impulse to start fires, but rather an affective disorder. Naltrexone may be used as pharmacotherapy for which of the following disorders? Mood disorders, impulse and disruptive behaviors, schizoaffective disorder, substance use disorders. Note, naltrexone, an opioid receptor antagonist, may be used as a pharmacotherapy for alcohol-dependent and opioid-dependent patient. It reduces cravings and feelings of euphoria associated with substance use disorder. Outpatient detoxification may be contraindicated for all of the following groups except persons with a history of delirium tremens or withdrawal seizures, persons with unstable medical conditions such as diabetes, hypertension, or pregnancy, persons whose withdrawal signs and symptoms are sufficiently severe to require 24-hour inpatient care. Adolescents. Note, options A through to C present high-risk patients who will require urgent medical attention which will not be easily accessible in an outpatient setting. Nearly 1/2 of patients with schizophrenia have which type of comorbid disorders? Hypertension, ADHD, trichotillomania, substance use disorders. Note, many patients with schizophrenia self-medicate with alcohol, prescription drugs, and street drugs. NB, if an option has 2 or more correct answers, it was answered based on exception. That is what the lecturer advised. In attention deficit hyperactive disorder/ADHD, there is high self-esteem. Emotion and social problem are not present. They tend to do good at school. Emotional outbursts are not observed. There is a boys' preponderance. These drugs can be used in ADHD, except methylphenidate, dexamphetamine, atomoxetine, imipramine, verapamil. The following are adult attachment disorder categories except autonomous, dismissive, preoccupied, unresolved, ambivalent, In disinhibited attachment disorder, there is no waving at strangers. There is checking back. Do not wander off. Awareness of physical boundaries. None of the above. Anxiety disorder in children. Fear is abnormal in children. Fear always causes impairment. It's always normal for any age and sex. Present same in adult and children. None of the above. Self-harm in children. Protest. Adolescents seeking for attention. Can cause suicide. Can bring about obesity. All the above. About tic disorders, all happen, except grimacing, blinking, singing, Tourette syndrome, sniffing. Tic disorders are present in sleep. Non-suggestible. Reduce with sleep. Increase with relaxation. Decrease with distraction and concentration. Pharmacology in children. Lithium is used in those under 18 years. All antidepressants are licensed for children use. Always children must be given drugs. Depression does not occur in children. Fluoxetine in child depression may be drug of choice if depression occurs in a child before commencement of medication. Records of weight are essential. Records of height are essential. Prolactin levels must be known. Lithium or sodium valproate can be considered. All the above. The UN Convention Rights of Child include to be housed, to be fed, to be educated. Child is 1 up to 18 years. All the above. About the abuser, the following may be true, except seek power, seeks gratification, has internal inhibitors, absence of external inhibitors. Child is vulnerable. Delirium. Consciousness. Attention. Perception. Walking. Behavior. Delirium. Hyper-alert hypoactive type. Hypo-alert hyperactive type. Hypoactive hyper-alert type. Hyperactive hypo-alert type. Hypo-alert hypoactive type. Epilepsy. Birth trauma. Head injury. Common in children under 10 years. Common in adults of over 60 years. Prevalence 50 out of 1,000. Convulsive status, whose status epilepticus I may not be. Generalized seizures. Myoclonic status. Febrile status epilepticus. Focal or partial. Complex partial status or psychomotor status. Supplementary motor cortex. Posterior to primary motor cortex. Lateral to premotor cortex. More on midline surface of the hemisphere posterior to premotor cortex. Contributes to control of movement. None of the above. Automatization may not be chewing, swallowing, lip smacking, grimacing, urinating. Absent seizures. Well-defined EEG. Abrupt. Brief alteration in confusion. Patients get immobile. Ends abruptly. May not be true about non-epileptic attack disorder. Pseudo-epilepsy. Psychogenic epilepsy. Attacks in public. Sufferer aware of seizure. Not meant for attention seeking. In ictal psychoses, the following may not be considered true. They are generally considered non-convulsive state. Partial complex status. Epileptic discharge. Delusions occur. There are no hallucinations. Transient post-ictal psychosis does not present with grandiosity. Paranoid delusions. Hallucinations. Psychotic aura. Post-ictal micturition. Personal history does not include infancy history, adolescent history, education history, hand deadness, where patient lives. Stage 3 ADC. moderate disease, end-stage disease, functional intellect, subclinical syndrome, cannot sustain complex conversion. In arson, an individual deliberately set fire. Serious offense. Risk to property. Risks to individuals. The arsonist has no intention of causing fire. In arson, setting of fire may be for anger, revenge, sexual dissatisfaction, manipulation. All the above. In pyromania, the following may obtain, except collateral history is important. History of relationships is important. History of alcohol is not important. Past forensic is important. Psychosexual adjustment is worth considering. Sexual Offenses Act of 2003. Rape is unintentional penetration of vagina with penis. There is consent in rape. Statutory rape is penetration of child of 16 years in England. Rape is intercourse with 13-years-old female who has not consented. None of the above. Abusers may be mentally sound, immature boys, want control, susceptible men. None of the above. Detention in mental health can be done by police on suspicion of mental disease. Can follow an order of detention. Can be done under emergency care. Can be at the president's pleasure. All the above. Harm from alcohol can follow except age, gender, settings, culture. None of the above. 750 ml of Jack Daniel's whiskey of concentration 42% alcohol volume has 35 units alcohol. 270 g alcohol. Safe to consume per week for males. Exceeds the normal alcohol needs per week by 10 units. Can be low risk if consumed over 4 weeks spread out per day. Mosi Lager beer, which is 375 ml and 4% alcohol volume, has 3 units alcohol. 14 g alcohol. Safe to take 10 bottles per week. A pregnant mother can consume 2 bottles per day per week. A man can consume less than 9 bottles per week for low-risk alcohol abusers. Delirium tremens. Presence in 10% cases. Tremors present first. Patient has no loss of contact with reality. Patient can sweat. Has 20% mortality. In delirium tremens, chlordiazepoxide 100 g/day can be given. Patients are all treated as outpatient. Haloperidol 10 g/day is essential. Vitamin B complex is essential. Electrolytes may not be as essential as sugar to be checked. Alcoholic hallucinosis. Auditory unpleasant remarks happen. Persecutory hallucinations occur. Withdrawal of alcohol need not happen. Antipsychotics are essential. Full assessment is necessary. Othello syndrome. Delusions of infidelity can be changed. Occasional accusations. Non-violent. Alcohol is only cause. Assessment is necessary. Marquis-Fava-Bignami syndrome. Neurological disease of alcoholism. Corpus callosum demyelination. Corpus callosum necrosis. Imaging is non-essential. Thiamine deficiency may occur. In alcoholic Wernicke's encephalopathy, alcohol should be stopped. Parenteral thiamine is essential. Delirium tremens can occur. Nystagmus is absent. Hypoglycemia can occur. In Korsakoff syndrome, liver disease can occur. No response to thiamine. Amnesia does occur. There is confabulation asterisk. There is confusion. Drug Act of 1971, Class B dependence drugs include cocaine, benzodiazepines, cannabis, barbiturates, ecstasy. Opiate intoxication presents with, except tachycardia, hypertension, mydriasis, slurred speech, tachypno. In substitution prescription, aims are to withdraw opiates. Introduce naltrexone always. Patient given progressive quantities of opiates. Reduce opioid use. None of the above. During methadone induction, ECG is essential. Electrolyte check is essential. Benzodiazepines can be increased. Cannot detoxify mother in first trimester. There is high risk of misuse. Buprenorphine is superior to methadone. Reduces craving. Has less withdrawal effects. Water soluble. All the above. Suboxone has buprenorphine. Has naloxone. Mixture is 2:1 buprenorphine/naloxone*. Useful in detoxification. None of the above. The following can be used for detoxification: lofexidine, methadone, buprenorphine, naltrexone. All the above. Stimulants include, except cocaine, methamphetamine, dexamphetamine, heroin, ecstasy. In postpartum depression, the following drugs can be of important use except nortriptyline, paroxetine, sertraline, diazepam. None of the above. Dysthymia, bipolar, I. In mania. Related to unipolar depression. Treatment is same as unipolar depression. Antidepressants are of use. Can use antipsychotics in its treatment. Psychotherapy is essential. Manic episode is essential in diagnosis. Depressive episode is non-essential in diagnosis. Hypomania is essential *. Cyclothymia is not essential diagnosis. Dysthenia is essential. Disorientation present *. Pressure of speech present. Delusions present. Hallucinations present. Catatonia may occur. In bipolar, 2. Depressive episode is essential in diagnosis. Mania is essential in diagnosis. Hypomania may present. Cyclothymia is not essential. None of the above. In depressive disorder, there is hopelessness, defection, always suicidal thoughts. Anhedonia presents. Loss PF interest. Mania. Hypomania is stage 2. Acute mania is stage I. Delirium present in stage I. Mania is stage 3. None of the above. Treatment of mania: lamotrigine, olanzapine, aripiprazole, lithium, haloperidol. Huntington's disease, autosomal dominant disorder, inherited disorder, chorea, 100/1000000. None of the above. Pathology in Huntington's chorea except gross atrophy brain, ventricular dilation, CAG repeats more 37 in each segment, tau bodies, chromosome 4 disorder. In Wilson's disease, tau bodies coded in chromosome 14, atrophy brain, autosomal dominant disorder, cirrhosis, Alzheimer's disease, senile plaques, neurofibrillary tangles, gliosis, tau bodies, myelination nerves, not a cholinesterase inhibitor, tacrin, donepezil, rivastigmine, galantamine, memantine. Schizophrenia positive symptoms include loss of interest, loss of energy, feeling controlled, apathy, flat affect, first-rank symptoms, audible thoughts, voices in second person, somatic passivity, delusions of grandeur, thought broadcasting. Crow type 2, dementia precox has except Predominant negative symptoms. Predominant positive symptoms. Enlarged ventricles. Poor responses to antipsychotics. None of the above. In schizophrenia, MSE can reveal the following except delusions, bewildered mood, excitement, confusion. None of the above. In individuals with somatic symptom disorder, medical tests suggest illness. Medical tests do explain the person's symptoms. Medical tests are either normal or do not explain the person's symptoms. Medical tests are either normal and do explain the person's symptoms. Factitious disorder. Cannot be imposed on self. Cannot be imposed on someone else. Formally called factitious disorder by proxy. None of the above. Sleepwalking. Happens in high-wave sleep. Common in adults. Cannot be homicidal. Has complex autonomic behavior. None of the above. Klein-Levin syndrome. Has excessive somnolence, hypersexuality. Compulsive overeating. Cyclical symptoms. Disappear in early adolescence. Lithium stimulants may help. Sleep cycle. Stage I has high voltage waves. Stage 2 has slow waves mostly. Stage 4 has sleep spindles. Stage 2 has K-complexes. None of the above. The following are problems of NREM sleep, except night terror, sleepwalking, bed soiling, encaprices, night mares. In children, settling sleep problems can include, except bedtime rituals, lots of attention and goodnights, transition objects, forcing child to sleep, gradual withdrawal of parents, stage 3 of grief, numbness, anxiety, reorganization, resolution, hypnagogic hallucinations, anorgasmia, hypothyroidism, diabetes neuropathy, medication, response stress, willingness. Note, failure to stimulate sexual response / excitement / plateaus in orgasm, present almost exclusively to females. Physical causes include hypothyroidism, DM neuropathy, meds, response stress. In sadism. Enjoys pain on others sexually. Receives pain sexually. Receives humiliation sexually. Can inflict pain on self sexually. None of the above. Somatic symptom disorders may not be. Are mental disorders. Manifest as physical symptoms. Can be explained fully by a general medical condition. Are not attributable to another mental disorder. Formerly called somatoform disorders. Note, formerly known as a somatoform disorder, is any mental disorder that manifests as physical symptoms that suggest illness or injury, but cannot be explained fully by a general medical condition or by the direct effect of a substance, and are not attributable to another mental disorder. Somatic symptom disorder are neurological and musculoskeletal, cardiac, pain, gastrointestinal somatic symptoms. All the above. Note, they are generalized in 4 major medical categories as above. DSM-5 and somatoform disorders. The patient must be excessively worried about their symptoms and judged out of proportion. The symptom must recur for at least 3 months. Symptoms are similar to those of other illnesses and last for years. Symptoms usually appear during adolescence. Often patients are diagnosed before age 30 years. Note, a diagnosis of somatic symptom disorder requires that the subject have recurring somatic complaints for at least 6 months. Somatic symptoms disorder may not be conscious malingering, fabricated or exaggerated symptoms of secondary motives, factitious disorders, exaggerated symptom. All the above. Note, somatic symptom disorders are not the result of conscious malingering, fabricating or exaggerating symptoms for secondary motives, or factitious disorders, deliberately producing, feigning, or exaggerating symptoms. In DSM-4, old classification of somatic symptom disorder, some conditions were listed as being somatoform disorders. Conversion disorder, body dysmorphic disorder, somatization disorder, hypochondriasis, differentiated somatic symptom disorder, Note, answered on the basis of exception. In DSM-5, 2013, somatic symptom disorders. Recognizable under term somatic symptoms and related disorders. Somatization. Hypochondriasis. Factitious disorder. Factitious disorder by proxy. DSM-5, 2013, lists somatic symptom disorders as illness anxiety disorder, pregnancy, psychogenic urinary retention, mass psychogenic illness, mass hysteria. None of the above. The basic but significant aim of management of somatic symptoms disorders include reduction of stress, coping with physical symptoms, dealing with depression and other psychological issues, improvement with quality of life and reduction in preoccupation with symptoms. All the above. Somatization disorders were first described by Sigmund Freud, Schneider, Briquet Paul, Futzing. None of the above. In somatic amplification disorder, hypochondriasis, a cough may be considered tuberculosis. Intestinal sounds may imply very serious sickness in the abdomen. Focus is on many symptoms as catalyst for worrying. Symptoms need to persist for 6 months. All the above asterisk. Above hysteria. Sigmund Freud and Jean-Martin Charcot dedicated research to hysteria patient. Most Western doctors do not accept hysteria as diagnosis. The word hysteria originates from Greek word uterus hystera. The Egyptians attributed the behavior to wandering uterus. All the above. Hysteria. Egyptian doctors prescribed various medications, such as strong-smelling substances, on patients' body parts or swallowing to encourage uterus remain in proper position. Ancient Greeks accepted the Egyptian practice and said these patients had inability to marry and bear children. As St. Augustine suggested that human suffering/hysteria resulted from sin, and so hysteria was demon possession. Hysteria patients in medieval and Renaissance periods were executed as witches after torture. All the above being true, Charles Lepois and Thomas Sydenham then theorized that the condition was a malady of brain and an emotional condition instead of a physical condition. Factitious disorders. Feigned illness with psychiatric condition. Malingering. Munchausen syndrome. The name was based on a fiction character, Baron Munchausen. All the above asterisk. The sleep cycle. Stage I has high voltage, mixed frequency waves. Stage 2 has sleep spindles and K-complexes. Stage 3 has mostly slow waves. Stage 4 has slow waves. All the above. Note, answered on the basis of exception. Functions of sleep include, except physical and psychological restoration and recovery, energy conservation, memory consolidation, discharge of emotions. None of the above. Sleep changes with age as follows. Total sleep time reduces. NREM sleep reduces. Sleep cycle shortens. Sleep more fragmented. Circadian rhythm changes. Tired all the time. Note, changes in sleep with age, total sleep time reduces, NREM sleep reduces, sleep cycle lengthens pain, sleep more fragmented and circadian rhythm changes, tired all the time. Psychological effects of sleep disturbance. Mood changes. Poor concentration. Disorientation. Hallucinations. Appropriate behavior. Note, psychological effects of sleep disturbance, mood changes, poor concentration, disorientation, illusions, hallucinations, persecutory ideation, inappropriate behavior with impaired awareness and automatic behavior caused by microsleeps. Some of the causes of sleep disorders. Periodic limb movement. Obstructive sleep apnea. Restless leg syndrome. Anxiety and affective disorders. All the above. Note, substance misuse, drugs, ACE inhibitors, B blockers, bronchodilators, and anorectics. Polysomnography. Depressed patient has stage 1 and 2 readings. Depressed patient lacks stage 3 and 4 readings. Depressed patient may have very shallow readings of stage 3 and 4. A depressed patient may benefit from a sleep disease and self-assessment scale, SDSS. All the above. In sleep disorders, stimulus control, good sleep hygiene, may include, except go to bed when sleepy. Use bed in bedroom 4S things. Get up when sleep fails in the morning. If sleep does not start in 10 minutes, one needs to get up and come back later. Exercise away from bedroom. narcolepsy, daytime drowsiness, chronic, loss of muscle tone which is sudden, cataplexy, occurs due to emotions, NREM sleep parasomnia, paradoxical sleep and lost, more common in older males, progressive course, benzodiazepine are effective, sleepwalking, nightmares and sleep cycle, stage I, stage 2 and 3, stage 3 mostly, stage 3 and 4, all the above, sleep problems in children, tonsillitis, epilepsy, obesity. Symptoms include bedwetting and snoring. All the above. Epilepsy and sleep. Night walks. Complex partial types mimic night terror. Bedwetting. Confusion. All the above. In children, sleep disorders may not first be settled by pharmacotherapy but avoidance of naps. Set sensible time every night. Bedtime rituals. Transition object. Gradual withdrawal of parents. Encopresis. Leak stools all day. With constipation. Without constipation. Has increased appetite. Has abdominal pain. Note, encopresis voluntary/involuntary passages of fecal matter outside toilet train content who are 4 years or older and who has no organic disease. Enuresis types are accept. Nocturnal enuresis. Diurnal enuresis. Mixed enuresis. Primary and secondary. None of the above. Note, types of enuresis include nocturnal enuresis, bedwetting, which is wetting that occurs in the night while asleep, diurnal enuresis, which is wetting that occurs during the day while the child is awake, and mixed enuresis includes a combination of nocturnal and diurnal type. Therefore, urine is passed during both waking and sleeping hours. Schizophrenias. Distorted thinking. Perception and effects that are inappropriate. Blunted effects. Thought echo. All the above. Schizophrenia. Thought broadcasting. Influence of passivity. Hallucinations. Thought disorders. Delusions of grandeur. Schizophrenia positive symptoms. Hallucinations. Delusions. Difficulty thinking/thought disorder. Feeling controlled. Passivity phenomenon. Schizophrenia negative symptoms. Loss of interest. Loss of energy. Loss of emotions. Blunted effect. Distorted thinking. Kraepelin and Neal 1856 to 1926 identified the following in schizophrenia, except dementia precox, youth psychosis, primary insanity, loss of inner intellect, abnormal association. Schneider-Kurt and the Schneiderian first-rank symptoms. Audible thoughts. Delusions of thought. Hallucinations, voices. Somatic passivity. All the above. Chrodementia of dementia precox type I may be, except type 1 dementia of dementia precox was acute. Predominant positive symptoms. Dopaminergic dysregulation. Good response to antipsychotics. Cortical tissue loss. Pathogenesis of schizophrenia. Evidence of developmental illness starting in utero. Has multiple genetic and environmental factors. There is glutamatergic abnormalities. Dopaminergic and serotonergic abnormalities. There is seen sulci and ventricular dilations. Pathology seen in schizophrenia. Grossly, there is reduction in structures such as corpus callosum. There is an increase in ventricular sizes. Grossly, there is an increase in structures such as corpus callosum. There is increase in size of putamen. There is increased myelination in temporal lobe and synaptic pruning. Delusions of thought are first rank. Delusions of control are first rank. Hallucinations are first rank. Other persistent delusions that are completely impossible are first rank. Change in quality of personal behavior is first rank. Diogenes syndrome. Neglect. Refusal of help. Syllegomania. Delusions of devils replacing someone asterisk. Hoarding garbage. Charles Bonnetti syndrome. Visual hallucinations in clear consciousness. Impaired sight. No neurological defect. Neglect. Seeing elephants at the neighbor's house. Atypical antipsychotics. Loxapine. Paliperidone. Iloperidone. Centendol. Droperidol. Neuroleptic malignant syndrome presents with higher fever, sweating, unstable blood pressure, stupor and catatonia. All the above. Neuroleptic malignant syndrome may be called, except hypothermia syndrome, serotonin syndrome, life-threatening neurological disorder, catatonia. All the above. Pathology due to bereavement and loss is seen from hypnopompic hallucinations, hypnagogic hallucinations, narcolepsy, oscillation in phase 1 and 2, stage 4 activity, pathological grief, has prolonged grief for more than 6 months, intense grieving, delayed first stage for more than 2 weeks, inhabited liking reaction and overreaction. All the above. Guided mourning. Confronts mourners in safety. Enters situation provoking memories. Exposure therapy. Aims to increase avoidance behavior. All the above. Kohlberg-Ross 1970, The Stage of Dying #. Anger, bargaining, denial, depression, acceptance. Depression, acceptance, bargaining, anger, denial. Denial, anger, bargaining, depression, acceptance. Acceptance, bargaining, depression, denial, anger. Acceptance, anger, denial, bargaining, depression. Is not a sexual disorder. Premature ejaculation. Paraphilia. Hypoactive sexual disorder. Gender identification. None of the above. Note, sexual disorders include erectile dysfunction, premature ejaculation, vaginismus, dyspareunia, anorgasmia, hypoactive sexual disorders, paraphilia, and disorders of gender identification. Von Krafft-Ebing classified sexual disorders in coined terms except homosexuality, fetishism, sadism, masochism, lesbianism. Note, von Krafft-Ebing, 1840 to 1902, classified homosexuality, promoted non-prosecution of inmate homosexuals. He coined terms homosexuality, heterosexuality, sadism, masochism, and fetishism. Premature ejaculation can be treated with, except behavioral techniques, stop-stat technique, anesthetic gel, SSRIs, non-squeeze technique. Note, TXT, behavioral techniques, squeeze technique, stop-start technique, anesthetic gel, delayed ejaculation, and if all do not work, SSRIs. Paraphilias F65 ICD-10. The disorder must be present for more than 6 months. Intense sexual urges and fantasies involving unusual objects or activity. The acts bring marked distress. Fetishism involves use of only one type of object. Can be treated by masturbatory reconditioning. Paraphilias F65 ICD-10, all correct except sadism receives pain during an act. Masochism has humiliation during the act. Voyeurism seeks gratification from watching others. Exhibitionists has repetitive desire to expose oneself for gratification. Disgusted/scared/screaming ensures gratification by exhibitionists. Gender identification disorder. Usually has stigma. Difficulty to distinguish from normal. Needs 1 year of observation after orientation. May require hormonal management. Always does not require surgery. About organic disorders. Huntington's disease is an autosomal received disorder. George Huntington described disease in 1501. It is a progressive motor disorder. Epilepsy rarely occurs. Executive brain functions improve. Pathology in Huntington's disease may include, except gliosis in basal ganglia, ventricular dilatation, chromosome 9 disorder, more than 37 CAG glutamate repeats. All the above. About Wilson's disease. hepatolenticular degeneration, autosomal dominant, copper ATPase dysfunction. Wilson described disorder in 1912. All the above. In CBT, coping strategies can include psychopharmacology, self-awareness, muscle tension, sweating, palpitation, Alzheimer's disease, shows gross atrophy brain, shows senile plaques, shows neurofibrillary tangle-style bodies, has gliosis. Only acetylcholine is implicated in disorder. Parkinson's disease is synonymous with multisystem degeneration, SLE, multisystem atrophy, progressive supranuclear palsy, GBS, non-inflammatory response demyelination, Pick's disease, vascular dementia, large vessel disease, small vessel disease, 80% sporadic, more common dementia, cholinesterase inhibitors except tacrin, donepezil, rivastigmine, galantamine, memantine. Atypical depression presents with except paradoxical anhedonia, comfort eating, hypersomnia, leaden paralysis, normal social activity. Unipolar depression is a single depressive episode without a manic episode, multiple depressive episodes without manic episode, dysthymia, cyclothymia. None of the above. Psychotic major depression, PMD, commonly depression with psychosis. There are delusions. There are hallucinations. Often mood congruent. Psychotic depression. All the above. Catatonic depression. Mute. Stupors. Immobile. Purposeless. Bizarre movements and cannot occur in schizophrenia. Postpartum depression, PPD. Occurs in 10 to 15% women. Sets in within days after labor. Lasts up to 3 months. Bonding goes on well. Paroxetine, nortriptyline and sertraline may be useful. Premenstrual dysphoric disorder, PMDD, may be considered. Premenstrual syndrome. Affects 3 to 8% menstruating women. Presents with clusters of affective behavioral somatic symptoms. Not associated with luteal phase. Management may consider SSFIs and for contraceptive pills. Bipolar disorder. A comorbid of two mental diseases on the same spectrum. Bipolar I has manic episodes with dysthymia. Bipolar II has depressive with hypomania. Any depressive disease may be considered bipolar II disease. All the above. Mania. Elation and hyperactivity. Delusions. Pressure of speech. Hallucinations. Increased energy. Mania. Acute mania stage I. Hypomania stage II. Delirious mania stage I. Delirious mania stage I. None of the above. Pathology of mania is not associated with. Non-consistent with right prefrontal cortex. Abnormalities in GSK3. Dopamine. Protein kinase C. Inositol monophosphatase. Mood stabilizers. Valproate. Lithium. Lamotrigine. Carbamazepine. Olanzapine. 38% alcohol content of 750 ml Southern Comfort whiskey has 20 units alcohol. 228 units alcohol. 38 units alcohol. 228 g alcohol. None of the above asterisk. About alcohol. 5 units per week is considered high risk in females. 400 milligrams per week is low risk males. 4 bottles of Mosi lager beer is considered low risk for males. 1 bottle of Mosi lager beer is considered low risk for females. None of the above. ICD-10 dependence syndrome. Evidence of tolerance. Persistent subuse despite clear overtly harmful consequences. A non-physiological withdrawal state when substance has been ceased. Neglect progressively of pleasurables. Strong sense of compulsion to drink. Delirium tremens presents with presence in 15%. Tremors in the limbs only. Orientation. Sweating. Bradycardia. Delirium tremens presents with mortality 20%, hypothermia, hyperglycemia, shock, all the above. Wernicke's encephalopathy is confusion, ataxia, nystagmus, brainstem hemorrhage, all the above. Korsakoff syndrome may not be associated with amnesia, confabulation, response to thiamine, confusion, all the above. Disulfiram works by inhibiting antiacetaldehydrogenase dehydrogenase *, anti-alcohol dehydrogenase, contraindicated in heart disease, suicide tendencies, hypotension, acamprosate, GABA antagonist, glutamate agonist, can cause irregular heartbeat, indicated to those over 65 years, all the above. Naltrexone, GABA antagonist, glutamate agonist, opiate agonist, DOS dependent, none of the above. Drug Misuse and Dependence Drug Act of 1971 Class C drug. Cocaine, amphetamine, methadone, benzodiazepines, ecstasy. About opiate intoxication, hypotension, meiosis, mydriasis, head nodding, euphoria, opiate antagonist, methadone, buprenorphine, naltrexone, lofexidine, clonidine. Cocaine intoxication shows by hypotension, bradycardia, meiosis, sweating, all the above. Positive attitude toward self, personal growth, integrator, and autonomy. A true perception of reality. Environmental mastery, adaptability, and healthy interpersonal relationships. None of the above. Insanity is accept. Delusional fantasy. Nightmare. Borscht painting. Kafkaesque world. Not elusive to non-sufferers. Section 3 in detention of persons ensures for 6 months and more. Suspicion of mental illness. Safety of others. Treatment in hospital. Pleasure. All the above. AIDS dementia complex stage 3. End stage, nearly vegetative. Moderate, cannot work or maintain the more demanding aspects of life. Mild, evidence of functional intellectual or motor impairment. Severe, major intellectual incapacity, cannot follow news. Subclinical, minimal symptoms of cognition or motor dysfunction. WHO classification of status epilepticus. Stage I are non-convulsive or stupor status. Stage 2 are convulsive or stupor status. Stage I may be generalized convulsive type. Stage 2 may be non-psychomotor status. All the above. About delirium. There are multiple etiological factors that are non-specific. It is a disturbance of conscious. There is fluctuating levels of consciousness and awareness of surrounding. Sleep-wake cycle remains same. It is worse at night. Severe learning disability. Rate of growth is slower than others. Self-care and motor skills retarded. Motor impairment. Incontinence. IQ 35 to 49 out of 150. In autism. There is no qualitative impairment in social interaction. No qualitative impairment of communication. There are only restricted repetitive stereotyped patterns of behavior. Lifelong disorder. Prognosis does not depend on time of speech. Anorexia nervosa may not be commonly female. Repeated dieting. Early puberty. Perfectionist. Good self-esteem. Theories of personalities according to psychoanalytic approach of Sigmund Freud are shaped by childhood experiences. Socially deterministic. Conscious motivation. Driven by ID, ego, and super-ego. Imbalance of ID, ego, and super-ego causes disease. Dramatic and erratic personality type. Schizotypal. Dependent. Avoidant. Narcissistic. Anancastic. About the stress cycle. Stress outcome may be sleep interruption. Adaptive action may mean poor performance. A stressor may be a very ignorant boss. Assessment of environment may lead to heart attack. Drinking more is an adaptive action. Post-traumatic stress disorder has many components for diagnosis, however of importance are reliving the experience, re-experience, avoidance, numbers, all the above. EMDRI movement desensitization reprocessing may be used in management of post-traumatic stress disorder. It is standard treatment. It is focused type of management. It has several elements. It uses bilateral stimuli. All the above.